Hi, welcome to this section of the cardiology. This is Dr. Jaitly. In this section, I'm going to be talking to you very briefly the basics of a question that's commonly asked: what are holes inside the heart? Well, we know there are congenital defects that the child or the newborn can be born with because of the structural defects that develop during the fetal period while the child is growing in the mother's womb. Now, during the fetal development, the septum, for instance, when it fails to complete, that results into small defects, and those defects can sometimes manifest as the child grows up into an adult, or even detected sometimes on a regular examination, sometimes based on the symptoms. And then one says, commonly used term, a hole in the heart. So essentially there are two types of defects that develop in the septum. Let's look at my favorite schematic here. You see the septum is dividing the heart into two. So it keeps the deoxygenated blood on the right side and the oxygenated blood on the left side of the heart. The atria on the top, the ventricles at the bottom. The deoxygenated blood is from the rest of the body is pouring into the right atrium, goes up the pulmonary artery when the right ventricle contracts, goes for oxygenation. That's where the gaseous exchange occurs. On either side, the lungs are situated in the chest. In the capillaries, the oxygen is taken into the blood and carbon dioxide is rendered to the air sacs of the lung so that one can exhale them out. Now the oxygen rich, which is oxygenated blood, finally gets to come back from the pulmonary veins into the left atrium and then into the left ventricle, and via the aorta it's pumped to the rest of the body, and the circulation continues to keep repeating over and over again. So what have we learned so far? Well, the heart is a beauty organ. Why? Because it keeps the deoxygenated blood from mixing with the oxygenated blood. You see this wall in between all along? So when the defects occur between these walls, like here, say there was a hole to manifest, quote unquote, or if there was a defect here in the atrial septum, this is the ventricular septum, then the atrial septal defect will be here and the ventricular septal defect can be here. Now, depending upon the size, depending upon the location in the ventricle or in the atria, there are different types, but that's beyond the scope of this video discussion. But right now, just the basic aspect of what a hole commonly that's referred to is in a hole in the heart is actually a congenital defect within the atrial septum or within the ventricular septum here. Now we know the pressures on the right side as well as on the left side are different. Where are the pressures higher? Obviously on the left side, because here the intra-cardiac or inside the heart, the pressures are high because the heart has to, one, pump harder against more resistance in the circulation, and two, it is also has to pump to a distant, much distant areas like from head to toe, rather than the right ventricle, which has only to pump to the lungs, which are just situated on either side of the heart within the chest. So it's a short distance travel from the right ventricle, whereas a long distance travel from the left ventricle. So the pressures are higher on the left side. Now, normally, if obviously in a normal heart, there are no defects, we have deoxygenated blood on this side, on the right side, and oxygenated blood on the left side. So now if you have a small, assuming that there is a small defect or a little small hole, quote unquote, what will happen? The blood will pass through from higher pressure chamber to the lower pressure chamber. So what is happening is oxygenated blood from the left atrium in the setting of atrial septal defect will mix with the right atrial deoxygenated blood. Follow? Now, say the defect is in the ventricular septum. What will happen next? Say there's a hole here. If there's a hole here, the left ventricle, when it contracts, it sends the blood up in the aorta, but some blood will escape through this little window here and travel into the right ventricle because this is a lesser pressure, obviously. We know from higher pressure to lower pressure, the fluid always travels, the blood always travels. So right ventricle this time will be mixing with some oxygenated blood. We know it's already deoxygenated here. So this mixing of blood will result into all the oxygenated blood again being sent to the lungs. So that's more work for the heart. So at this level, just try to understand, a hole will imply there is more blood going to the lungs in addition to the already the amount of blood that's traveling to the lungs. We'll have more blood going because it's receiving blood from either the atria defect or the ventricular defect, if it is existing. Obviously, there'll be a heart murmur. There might be arrhythmias, and which is irregular heartbeats, and an abnormal EKG. So these are the earliest symptoms and signs that can be picked up at early age or sometimes even in an adult age where the defects are. Like in an echo, one could see the gush of blood going from the interatrial septum here, or from interatrial septum here, or the ventricular septum here. And one could see that from the left side, it'll travel to the right side, this being the right ventricle, or from the left side here, this being the left ventricle, into the right ventricle here. There will be a defect here for the VSD. ASD will be shown as a defect here. Sometimes it's not detected on a regular transthoracic echo. It could only be manifested in a transesophageal echo. And we'll talk about that at a later time. That's a more sophisticated technique. So manifestations normally, it could be clinically asymptomatic or shortness of breath, palpitations, heart murmur, arrhythmias, abnormal EKG. Those are the ways it manifests. Chamber enlargement will follow next because obviously it's receiving more blood into the right atrium or more blood into the right ventricle. So these chambers will start to enlarge first. And there will be heart murmurs because of the increased flow. Okay. Hope you found this fascinating, interesting, because obviously this is a very, very, interesting part of our clinical discussion, both in medicine and cardiology. Well, stay tuned and we'll be discussing more intricacies later down the line. Thanks so much for your attention.